I was actually fortunate to stay for the whole work group meeting, and I can tell you there was a lot of discussion around the attachments rule and the prior authorization rule, and how they're actually in some ways in contention with each other, and trying to get the industry really starting to think about the implications of those two rules and the guidance or the recommendations that need to go back to CMS on those two rules. So will we see, for example, clinical data exchange as an implementation guide being added to the prior authorization rule? Will we see the attachments rule being recommended to stay around healthcare claims and not muddy the water around prior authorization? So there's a lot of interesting things going on right now. But the whole thrust of those two rules is really towards reaffirming that CMS is very, very intent on driving interoperability, and FHIR is the standard going forward. So it'll be really interesting to see that, how that evolves, and we're all looking to see that feedback from going back into the proposed rulemaking and what the ultimate rules will be. Plans need to be thinking about prior authorization now, because CMS is expecting them to take something like about 30 months to get systems implemented.
Along with the electronic prior authorization, I think there is an advancement of interoperability rule that got released on December 6th, which is other than the prior authorization process, what do you need to do on the patient access API, what do you need to do on the peer-to-peer, what do you need to do on the provider access API. I think those are very important part of the rules as well. And payers have to pay more attention towards these rules and then see how they can engage themselves as soon as they can.
When you look into that rule, there's metrics that are going to be gathered around the utilization of these APIs. And so plans need to be thinking about having some of these APIs in place in 2025 so that they can actually report on them in 2026. So again, there's so many facets to this prior authorization rule that payers need to be paying attention to, and also being aware that providers are going to be measured on their use of these APIs. So CMS is going to be gathering data about how these APIs are being put to use. The rule is really focusing about determining whether a prior authorization is required, determining what information is required if it is, and then communicating the result to payers, providers, and patients once the decision's been taken. And that's really, it's not really changing the adjudication process itself at this phase.